Good right afternoon, everybody. This is Eric Saviano coming to you live from Enroll Nebraska headquarters in Lincoln, Nebraska. Thank you for joining our webinar today, basically talking about Nebraska Medicaid 101 outreach and resources. We are going to cover quite a few things today, and we're excited about our speaker, Molly McCleary from Nebraska Appleseed here with us. So we're going to jump right in. To get us started, this is me. That's a nice picture, I think. I'm the statewide coordinator for Enroll Nebraska, and we are always available to answer questions about the ACA, Marketplace, Medicaid, and other issues related to healthcare in Nebraska. So we're excited to have you here. Once again, thanks for being here, and thanks for sharing the link with folks that you know. Today we're going to be reviewing some basics about Enroll Nebraska. We're going to talk about the uninsured in Nebraska at this point, or as close as we can get with current data, so that everyone we can have kind of a benchmark of where we're headed and what we're doing to get folks enrolled. Nebraska Medicaid 101, where I'll hand it over, and then outreach and resources, things that you can do to do outreach in your small networks so that we can make a big impact. Always, we will have time for questions and answers there at the end. Quick highlight, up there in the right-hand corner, you have the webinar materials. They can be found at enroll-ne.org/EEG, which is Education and Engagement Group. So feel free to download these slides and find materials afterward once this is finished. We're going to have we're recording the webinar right now, so there is a chance for folks who couldn't make it today to get on and do that, watch it another time. So let's see. All right. So we'll also direct everybody. Everybody is muted. You should be able to hear me, but everybody is muted right now. So if you have questions, and you do throughout the webinar, please post them in the message box, and we will get to them as we see them, and we will definitely get them at the end of the webinar. So feel free to be typing away in there if you have questions and you need help remembering them, or just wait until the end and we'll have time to answer them a little bit later. Okay, so I'm going to go over a couple things about Enroll Nebraska and then end with a quick survey of the group. Enroll Nebraska is about 4 years old. We've been working on enrolling folks in ACA coverage since the passage of the Affordable Care Act, ACA, in 2010. We are a network of community organizations, enrollment assisters, and healthcare providers, as well as advocacy groups from here in Nebraska. We are a program of Nebraska Appleseed as well. We offer a lot of services for the community, including enrollnebraska.org and all of our social media. On enrollnebraska.org, we have an in-person assister map, which we keep up to date, and it houses all of the organizations that have agreed to be assisters for free to people who need help getting enrolled in health insurance. The ACA brought in all kinds of new folks to that world, and we are here to help, at least direct folks to the in-person assisters. Next, we have an event calendar that posts things that are relevant to consumers as well as enrollment assisters, so take a look at that. And also, we'd love to do more presentations just like we're doing now to your organization or people around you. We also do Facebook and Twitter, and would direct you there for keeping up to date with what we're doing. Lots of blogs, lots of great infographics and things you can share through those portals. The next thing I want to share about is the Education and Engagement Group itself. This is an initiative we've been doing for about what would you say, probably 6 months or a year, where we are trying to get as many folks onto these webinars and part of this network as possible who are not directly related to healthcare, so that they can spread the word about the ACA and what we're doing to get people enrolled. So folks on the call, we're excited to teach you more about what's going on in the healthcare world in Nebraska, but we're also hoping that you'll become our advocates and share with your networks in whatever way that you can. And we'll offer some ways at the end of this webinar, but about health insurance. We meet every other month or so, and we also feel that this is basically a low time investment for you all, maybe an hour every month or two. And it has a high impact if you can do some of the steps that can take us forward. All right, so the next thing I'd like for you all to do is participate. We're going to have 3 or 4 opportunities like this during the webinar. We are going to do a quick survey of the group to see what kind of topics you're interested in hearing about next. I'll let everyone know, maybe you can see, but we have 44 people on the webinar right now. And we're excited to hear what things you'd like to hear from this group in the future. So let's take a minute. I have opened the poll. I'm going to make them public at the end. And I've started the poll. It says, what healthcare related topic would you like to see covered on a future webinar? Medicaid Beyond the Basics, health insurance literacy, women's health and the ACA, immigrants and the ACA, and special enrollment periods. Great, we're seeing the numbers come in. It looks like we have quite a few participants so far, but more and more are coming. And everybody wrap up. I'm going to give you a couple more minutes, 30 more seconds, and we'll jump in. If you have an other option, we do have an other option, but that is basically typing your answer in the chat box. Should have mentioned that. Okay, I'm going to end the poll now. Great. So hopefully you can see the results now. Clearly, Medicaid Beyond the Basics is something that people are interested in hearing about. And we can definitely target a lot of our work toward that in the future. So I'm glad to see all of the participation from folks. Thanks so much for participating in that. We'll also get to these other topics at some point in the near future as well. We have the knowledge and we'd love to share. Okay, so with that, I want to just share some basics about the uninsured in Nebraska that we've been learning about very recently. We've gotten some new census data, new American Community Survey data, and here's the basics of it. Back in 2013, the uninsured in Nebraska, which is right when the ACA open enrollment period started, our uninsured number in Nebraska was low for the country, but it still was at 14.5%. In a state of 1.8 million, we brought that down in 2015, the end of 2015, to around 10%, which is a pretty significant drop. It still leaves 178,000 Nebraskans uninsured, and they're uninsured for a number of reasons, including the Medicaid coverage gap, which encapsulates probably about 100,000 of those. But 35% of those, we have learned, about 62,000 people in Nebraska are in some way eligible for Medicaid or marketplace coverage. That's kind of a staggering number. It shows a little bit of the work that we have to do, and one of the reasons for this group. Specifically, we need to get in touch with these people who don't have the insurance and are eligible for one or the other. Folks who are not, like I said, the coverage gap at the bottom there is one reason folks are not eligible and are uninsured, but immigrant, some refugee populations are encapsulated in that as well. All right, so to take us to the next level, I'm going to pass it over to Molly McCleary, who has prepared an interactive and interesting Medicaid 101 presentation for us all. So once again, you have the option to write questions in the chat box. Sorry about, I see a couple of notes on our chat room that say the slides are blurry. Sorry about that. I don't know how to fix that one. We're doing the screen share thing. And then the audio repeating itself. I'm not sure if that's a problem for everyone either, but believe we have it isolated. So we're going to jump in, and I'm going to turn it over to Molly.
Hi, everybody. As Eric mentioned, my name is Molly McCleary, and I'm the staff attorney in the Healthcare Access Program at Nebraska Appleseed. I will be going over a number of topics with about Medicaid today. We're going to touch on a lot of different things, and just to preface our conversation, there is a lot to talk about when we talk about Medicaid and the Children's Health Insurance Program. So what we wanted to do today was kind of give a really broad brush overview of some of the topics that you might be facing out in the community. I know that folks are coming from a number of different perspectives and a number of different organizations. And so I wanted to hit kind of as much as I could. But as Eric mentioned, we are more than happy to do follow-up webinars about specific topics within the presentation today, or in-person presentations, or anything that might be helpful. So to get started, we will talk generally about what Medicaid and the Children's Health Insurance Program, or CHIP, are. We'll talk about eligibility for these programs, what kinds of services people who enroll in the program can access, eligibility of immigrant populations for Medicaid and CHIP, how to apply for Medicaid, and then also some of the client rights that people who are enrolled in the program can have, such as due process and appeals. So, Medicaid and CHIP, what are these programs? Medicaid is a public health insurance program that provides health insurance to certain eligible low-income individuals. We'll talk about this in more depth, but the general sort of rule is that to be eligible for Medicaid, you have to fit into one of the categories that is listed on this slide. So you have to be a low-income parent, a child, a pregnant woman, a senior, or a person with a disability. You're not eligible just because you have a low income. It's important also to note that Medicaid is not Medicare. Medicare is a public insurance program predominantly for seniors, and it's not income-based in the way that Medicaid is. The Children's Health Insurance Program, or CHIP, it's also known as Kids Connection in Nebraska, I believe. This is a public health insurance program that provides coverage to children up to age 19, and it is up to a higher income level than Medicaid is. And we'll talk about that in more detail, but those are the programs that we'll be talking about today. So Medicaid is a federal and state cooperative program, or cooperative system. And what this means is that states have the option to participate in Medicaid. All 50 states do participate in the program, but when states opt into participating, essentially they're agreeing that they will follow certain federal rules, but also retain some flexibility in how they want to administer the program within the state. So at the federal level, the Department of Health and Human Services Center for Medicare and Medicaid Services, or CMS, is the agency that administers the Medicaid program. At the state level, the Nebraska Department of Health and Human Services administers the program, and those two agencies work together so that the state has to follow certain rules or parameters, but then also has some flexibility to make choices about what is best for folks in that particular state. So looking at Medicaid eligibility, as I mentioned, a person is not eligible for Medicaid just by having a low income. To be eligible, you must have a low income or an income that's below a certain level, and then also fall into a particular category based on your personal characteristics. We'll talk more about those categories in the next slide. You must also meet other requirements like citizenship or having an appropriate immigration status, being a Nebraska resident, and then some categories have to do resource or asset tests to make sure that the amount of assets they have falls underneath a certain level. So I think it's easy to think about this as kind of a 3-step question. So you have the first step of whether you have the right income. Do you fit into one of these categories is the second step. And then also, do you meet some of these other questions like immigration status, residency, etc. So the categories that a person must fit into, as I mentioned on the first slide, are pregnant women, children, very low income parents, seniors, and individuals with disabilities. And the income level under which you have to fall to be eligible for Medicaid varies depending on which of these categories a person falls into. So when we say very low income parents, they must be below 58% of the federal poverty level, which is this year $974 a month for a family of 3. So that's the lowest amount. That's the lowest end of the spectrum for what someone could be eligible for Medicaid. Seniors, individuals with disabilities, and pregnant women are all set at income levels above that. And then children have the highest income level at 213% of the federal poverty level, which is about $3,578 for a household of 3. So you're in between roughly 974 and 3578 is kind of where all of these income categories fit together. So to say it again in a different way, to be eligible, you have to fit into the category, and then the income level that you have to meet varies depending on which category you fall into. So who is ineligible for Medicaid? So we know that those 5 groups are eligible if they meet the income requirement, but who is ineligible? Generally, if you do not fall into any of those eligibility categories, you wouldn't be eligible. So, or if you fall into a category, but your income exceeds whatever the limit is, then you would also be ineligible. We talk a lot about the coverage gap or the Medicaid coverage gap. A lot of people that are currently ineligible for Medicaid fall into this in that they are adults without children. Adults without children, if they do not have a disability or they are not a senior, are never eligible for Medicaid, even if they have 0 income. Working parents have that very low 58% of the federal poverty level threshold. If they make above that, then they are not eligible for Medicaid. These folks would be ineligible for Medicaid and then also ineligible for marketplace subsidies. And that's why we refer to them as falling into the coverage gap. Additional groups are ineligible, and these are individuals who are not lawfully present in the U.S. So generally undocumented immigrants would not be eligible. And then also folks who aren't Nebraska residents. So that if you're a resident of another state, or if you have an immigration status where you can't demonstrate Nebraska residence, then that would also be a reason for ineligibility. And we'll talk a little bit more about how the residence question with immigration status in a little bit. So we have a pop quiz, which I cannot be held responsible for the Keanu Reeves clip art that we have here, but that's all Eric. So we have a pop quiz to kind of review what we've talked about so far. And Eric's pulling up a poll here to do this. And so we have a poll in your chat box, and the question is, which of the following are considered when determining Medicaid eligibility? Income, citizenship, immigration status, fitting into a particular category or characteristics, or all of the above? Well, it looks like you guys are all right. All of you who have answered so far. It is all of these things. And so that's why we say that it's sometimes a complicated inquiry into whether someone is eligible. It's not just a matter of having low income. It's a matter of low income plus all of these other factors. So great work. You guys are all experts now.
Hot shots. Even.
Hot shots, yes. So let's talk about, now that we understand kind of the basics of whether someone is eligible, let's talk about, we have a question. How can you have a working family without children, but have a family of 3? Who would be that third person if there are no children? So the working family example, I believe that what we're talking about is on the previous slide. The working family, yeah, it should not say, that's an error on the slide. It shouldn't say working family without children. It should say working family with children. So you caught that. That would be if you have a parent and 2 children, or two parents and a child. Over that income level would be ineligible. So good catch. We will fix that before we send the slides out. But yeah, it should be some working families with children if they earn over that $971 a month for a family of 3. And I will say too, the reason we use the family of 3 is that it makes the most sense in that we wanted to standardize across the different categories. So we wanted to pick one eligibility level for all of the different categories, or one household size. So, okay. So now that we've talked about eligibility, we can talk about what services are covered under Medicaid. So let's skip ahead to the next slide. The mandatory. Yep, there we are. So as I mentioned, Medicaid is a federal state cooperative program. And this is really where the services is really where you see that cooperation. So federal Medicaid law spells out which services a state has to cover if they have a Medicaid program. There's a certain menu of services that if you have a Medicaid program, you have to provide those to eligible people across all those categories. And those are things like physician services, labs, x-rays, inpatient, hospital, or nursing facility treatment. The list is much longer, but it's sort of when you think of what you think of as the basics things that should be provided in an insurance plan, those are the things that are covered services. They're spelled out in federal law and then also in Nebraska statutes. So every state across the country has this certain baseline level of mandatory services. Then I went the wrong way. Will you help me? Mm-hmm. Sorry, I'm not the most tech savvy, so I'm having to have Eric help me even move the slides. Okay, that's where we are. So on top of the mandatory services, there's optional services that states can decide to incorporate into the benefit package that they offer. So states can go above and beyond and say, we want to offer this service or that service. And every state has to have what's called the Medicaid state plan, which lists out who is covered and what services they offer. And so some states have, decided we're going to offer prescription drugs, we're going to offer dental, and some of these other things, and others haven't. So across the U.S., you'll see there's a fairly wide range of the robustness of services or benefits that are offered. The optional services include things like prescription drugs, prosthetics, dental treatment, and things like private personal care. There are additional optional services spelled out in federal law and then also in our state statutes. I think it's important to note that Nebraska is has a pretty robust or pretty decent benefits package for folks that are on Medicaid. I think we would be probably in the middle of the pack or kind of on the more robust end. And I think that is a good thing if you look at what some of the optional services are in thinking through that Some of them don't really seem that optional, like when you think about dental or prescription drugs. And so that is what has to be offered in a benefits package. For children, there are some special rules. So for children, there is what is called the early and periodic screening, diagnosis, and treatment. It's a mandatory service for Medicaid eligible children. Under federal law, states are required to provide all necessary treatment that's listed in those 1396 DA is where optional and mandatory services are covered or listed out. States are required to provide all of those in order to treat or correct or ameliorate physical or mental illnesses and conditions in children, even if it's not covered under the state plan. So this is a really complicated way of saying that for kids, this mandatory optional distinction doesn't exist. For kids, everything is mandatory. And if there's something that is necessary to correct or treat a physical or mental illness in a child, if it's not covered under our Medicaid state plan, it's optional, or it has to be covered. It's necessary treatment. So again, in other words, no mandatory optional distinction for kids, the same way that there is this mandatory optional distinction for adults. That makes sense intuitively if we think about how the needs of children are different than the needs of adults. So, childhood dental, you might need more screenings. You might need different things like hearing screenings and things like that maybe an adult wouldn't need in the same way. So, okay. So then we'll shift to, now that we've talked about eligibility, we've talked about services, we'll talk more in depth about immigrants and Medicaid eligibility. I know that this is a topic that a number of folks on the webinar encounter fairly regularly. It is very complicated, and we will just touch on it. And we have some resources that we can send out both after the webinar and that are also attached in the slides to get into this in more detail. But this will just kind of be a really broad overview of the general rules on this. So limited categories of immigrants are eligible for Medicaid. As we mentioned earlier in the presentation, in addition to income and category of need, and then also residence and things like that, a person's immigration status or their citizenship status is taken into account. To be eligible for Medicaid, you have to be known as what is called a quote unquote qualified alien. And depending on the type of immigration status that a person has, that determines whether they are considered a qualified alien or not. So, for example, lawful permanent residents, refugees, certain trafficking victims, persons who've been granted asylum or withholding of deportation or withholding of removal, they would be considered qualified aliens. Other immigrants are considered not qualified, which means that they're not eligible. This includes undocumented immigrants, and then also a number of people who are considered lawfully present in the U.S. but don't fit into that list of what qualified aliens are. So that's kind of the distinction on the top level. What we'll get to is the fact that the world of immigrant eligibility for Medicaid is exceptions and then exceptions to exceptions and then an exception on top of that. And so we'll just give the kind of broad overview and then try to address some of those exceptions. But in addition to being needing to be a qualified alien, there's also a residence requirement. As I mentioned, you have to be a Nebraska resident. And to do that, you have to show an intent to remain in the state. Where this becomes tricky is folks who are in Nebraska on student visas or other temporary visas. They are technically lawfully present in the U.S. They're lawfully present in the state. However, because their visa is time limited, they can't demonstrate that they have an intent to remain in the state without potentially jeopardizing that time limited nature of their visa. So that is another wrinkle. And then there's an additional wrinkle known as the 5-year bar. So for folks who have lawful permanent resident status, they achieve that status, they have to wait 5 years in that status prior to being able to access certain federal benefits, including Medicaid. A lot of this was an outgrowth of welfare reform in the mid-1990s, and we're still sort of navigating the repercussions of that today in some of our eligibility systems. Okay. We're seeing the audio is bad. Does this help any if we're closer?
Can we do a test real quick? Test. Oh, it's better. Possibly we're having some slower internet on our end. So it's good now. We're going to keep moving.
Okay, I'm going to sit really close to the microphone. Okay, so what we have is, this is the sort of general overview or the general lay of the land. What we get to now is these exceptions for certain specific eligibility designations. And what that means is that what I just told you about having to be a qualified alien or the 5-year bar and things like that. Okay, yeah, I will. Julie, I see there's a request to review this info again. So we'll run through this slide again since we had the audio interruption, and then move on to the next piece. But so limited categories of immigrants are eligible for Medicaid. So you must have this qualified alien distinction in order to be eligible for Medicaid. Depending on a person's status, they will be either deemed a qualified alien or not. So a person's status dictates whether they are considered a qualified alien. Certain statuses like lawful permanent residents, refugees, people granted asylum or withholding of removal, conditional or trafficking victims, they would be considered qualified aliens. That's not an exhaustive list. Those are sort of the ones that we run into a lot. So that qualified alien is what you have to be eligible for Medicaid. There are some specific eligibility distinctions or designations, or as I call them, the exceptions, that we'll cover on the next slide, that throws a wrench into the whole qualified alien thing, but generally that's the rule. There are other immigrants who are in the US who are not qualified aliens, which means they're not eligible for Medicaid. This includes undocumented immigrants, and then also others who are not who are lawfully present in the US, but don't fall under that list of statuses that make someone a qualified alien, and that's all spelled out in federal law. People also have to meet a residence requirement in order to be eligible for Medicaid. This is where you are in Nebraska and you have an intent to remain. Where this becomes tricky with immigration issues is folks who come to the US on temporary visas, like student visas, where they're lawfully present in the US. However, because of the time-limited nature of their visa, they can't demonstrate that intent to remain in Nebraska. Lastly, there is what is called the 5-year bar. So though there are certain qualified aliens, like lawful permanent residents, who would seemingly be eligible based on being a qualified alien, because of their status as a lawful permanent resident, under federal law, they have to wait 5 years in that status prior to being able to access certain federal benefits like Medicaid. So we'll go to a couple of the exceptions to what I've just said. And I see there's a number of questions in the sidebar. I think we'll go through this next slide, and then we'll be kind of at a point where we can answer some of the questions that are coming up before moving on to the next topic. So emergency Medicaid is kind of one of these special designations where a person must meet all other Medicaid requirements, but the immigration status is irrelevant at that point of accessing the service. So if they have the income requirement, if they meet the category requirement, and it's qualified as being an emergency situation, the rules around immigration status, the same ones don't apply. There's also the unborn child option or 599 CHIP, which is where a mother can access pregnancy-related services on behalf of her unborn child. In that case, because the pregnancy-related services are being provided on behalf of the U.S. citizen unborn child, the immigration status of the mother is irrelevant. And then lastly, there is what is called IKEA, which is the Legal Immigrant Children's Health Improvement Act. This is specifically designed to address issues with coverage for lawfully residing children under 19 and pregnant women, specifically that 5-year bar issue I was mentioning. For these groups, if they meet the low income threshold, the lawful presence, and the state residence, they are able to, in certain circumstances, avoid that 5-year bar. So as I mentioned, this is all very quick. We could do a whole presentation just on 599 CHIP or IKEA, but I just wanted to mention that, mention those things and say that with immigration related issues with Medicaid, it is very much, here's the rule, here's the exception, here's the exception to the exception. And so it is tricky, and we'd be happy to talk more in depth about any of those issues. I see there's a couple questions related to some of the stuff we've talked about so far that I can address before we go to the next topic. I see there's a question related to what optional services does Medicaid cover in Nebraska? We cover, off the top of my head, I will not be able to tell you all the ones that we cover, but it is listed in state statute. We cover dental, we cover prescription drugs. Those are the top 2 that are coming into my mind right now. But I would be happy to email out with the slides. I can list out the list of optional services as well. The senior, at what age does senior start? That starts at age 65. And then we have the question, what is income per person for households larger than 3 people? What amount? Oh, so yeah, we just picked 3 people because that would embrace different that would embrace pregnant women, child, low-income parents. That would kind of bring in all of those and provide a baseline. But the income range does increase with each additional family member for each category of Medicaid. So no matter what category you're in, the number of people in your household will impact what the eligibility threshold is. And so it doesn't go up by a standardized amount, I don't believe, but it is dictated by, it goes up every year with federal poverty levels changing, but then it also, each additional member of the family adds on top of the amount that I mentioned. So I think those are the ones that we have gotten thus far. We'll go through, the next stuff is pretty easy, and then we can hit any other questions that we have at the end. So Now that we know who is eligible, what services must be provided, how does one apply for Medicaid or CHIP? So I know a lot of you on the call are familiar with the federally qualified health centers in your communities or some of the clinics in your communities. There are sisters in those places that can help folks apply for Medicaid. You can also apply through the Department of Health and Human Services through Access Nebraska, through the online Access Nebraska portal, or over the phone, or by going to a local office if that is an option for you. So there are a number of different ways to apply for Medicaid. When going to apply for Medicaid, the person should be ready to provide documents that verify eligibility. So these are documents that would verify both the income level of the household, so things like pay stubs from the last month, or if you receive Social Security, what that income looks like. Also verifying citizenship, or if you're here on a visa, those sorts of documents. So each of the eligibility pieces that we mentioned, like the fitting into a certain category and the income, will need to be proved up through some sort of documentation. After an application is submitted, the department has either 45 days for a person without a disability or 90 days for a person with a disability to determine eligibility and provide benefits. After application and enrollment in the program, folks who participate in Medicaid have certain rights and opportunities for due process and appeals. So what this means is that a person who applies for Medicaid or receives Medicaid has the right to notice about changes in their benefits or eligibility, and then also a right to an administrative hearing when our services are not covered or they are not acted upon with reasonable promptness. So the reasonable promptness goes back to that 45 or 90-day time frame that I just mentioned. So these are just a couple examples of when a client might have the right to an appeal, a determination. These are when they apply for Medicaid and are denied, or they their application is not acted on with reasonable promptness, when their benefits are reduced, suspended, or terminated, or any action or inaction in relation to their case. When looking at the timeline for filing an appeal, a client has 90 days from the date of the notice of decision to file the appeal. So any sort of decision that they get, whether that is saying you're not eligible for Medicaid or this particular type of service is not covered, or something like that, it's 90 days from the date of that notice that a client has a decision to appeal. If a client appeals within 10 days of receiving that notice, the decision does not take effect and you can keep your benefits during the appeal process. But if you lose the appeal, you can be required to pay the benefits back. So where we see this is if someone's Medicaid is terminated for whatever reason, and they appeal within 10 days, that decision regarding termination of benefits can, you can have that not go into effect. But if in the few to several months following, the client ends up losing that administrative appeal and is deemed not eligible, they have to pay back what they received for all the months when the appeal was pending. So that's a choice that clients have to make, whether they want to sort of gamble that risk or not. If a client appeals after 10 days, but within that 90 days, and wins the appeal, they can get any back benefits that they lost during the appeal process. So if you appeal after 10 days, you can't keep your benefits during the pendency of the appeal, but if you win, you can get the benefits back. So this is all to say, this is a lot that someone needs to consider when going through this process. You don't have to have an attorney. You can do this on your own. But it's a lot for an individual to think about. So I think we have a quiz.
Well, it's a question.
It's more of a question.
Yeah.
The question is, this is confusing, and I would like a training just about this. So I would like another training on these topics. Okay.
We're getting some answers coming in. I think it makes sense that we're kind of split. I think lots of folks have their services, their what they need met by this general information, but maybe some more folks on the call, on the webinar, could use even more information. So
I think we're about half and half. So
yeah.
Okay. Well, that really covers the substance of what we wanted to talk about today. And I think we have some resources that we've linked to here. We have a brochure that's just kind of about the last couple slides of related to administrative appeals and some of those decisions that clients have to make. We also have a guide that goes over the ins and outs of immigrant eligibility, and these resources can be found online at the Enroll Nebraska website. But if there are any other resources that you would find helpful in your work in the community, let us know, and we can pull them together or send along stuff that we have. So I'm getting a question about having to bring documents to show where someone lives. Not outside of proving the residency issue. For most folks, that's not going to be a huge issue unless there is an immigration status issue or like a moving from state to state issue. But you will have to prove an address in terms of where you want notices and things like that to come to.
So at this point, I want to do our last quick poll, but this is something to think about while you're thinking your questions and putting them in the chat box for Molly. So this last one really relates to how we can help you get this information out to people in your networks. So we gave you a starting point, but we'd love it if you wanted to write other things in the chat box. So if your organization wanted to take this information and spread it with the community, what's one way you might do that? So we have a poll open now, but also please put your questions and answers in the chat box. I'm going to leave this poll open while Molly answers a few more questions.
Okay. Getting questions. Where am I? Okay. Do medically fragile children, babies have the option of getting Medicaid even if the family can get insurance or don't income qualify? That's a tricky question. I don't want to say yes and I don't want to say no without knowing more about that particular family's situation. I think if a child has a disability determination, or if there are if the child's family can fall under that category, I would want to know. I guess I don't want to say yes and I don't want to say no without knowing more about that, but I would say possibly. I think presumptive eligibility would be a good topic to talk about. I think that's a great idea and something we would love to talk about further. There is an income limitation for adults over 65 for Medicaid. As I mentioned, I believe is, it depends. There is kind of a range of range of income for seniors, it's between, I believe, 100 and 200%. And so depending on that person's situation, the income level might be a little bit different, but there is an income limitation. Yeah, we will, resources listen. Okay. I submitted an application via Access Nebraska, however, being told the application showed as an supplemental app. So James, I think that is related to, you have a question about submitting an application via Access Nebraska, and then the application showed as being an Obama application, and a supplemental application is being mailed, cannot even fax the supplemental application due to it being too big. I was told, how did this happen? I don't know if, what in that situation happened was if that was a situation of Medicaid and the marketplace communicating, if you had an issue where you were technically, or that person was eligible for marketplace coverage versus Medicaid coverage. I'm not sure what, that's the only thing I can think of in that case. Yeah, if my email is up on the screen. If you want to email me, I can follow up with you about that particular situation. And we're getting, yeah, a lot of input on what resources would be helpful. I think that's all of the questions. But yeah, I think that's really helpful to know that folks are interested in presumptive eligibility. I think that there are some questions specifically around like child health issues and maybe special needs children or children with high health needs that we could also address as well.
All right, so this is kind of a last call for questions. And while I am wrapping up, if any come in, we'll mention it. But let's see. First of all, I really want to thank Molly for being on the webinar and for sharing all this good information. This is going to be replayed. It's going to be a video on YouTube as soon as we hang up, basically. So it will be sent to you in about an hour with the link to this webinar to repeat it if you need to, or to forward it on. We do have another webinar coming up of this kind, but based on the SHOP program, which is for small businesses seeking to enroll their employees. So it is at that same website, enrollnebraska.org/EEG. I see a copy of this PowerPoint is requested. That is also available right now on enroll-nebraska.org/EEG. And let's see. You all are now on our emailing list, so you'll hear about more of these opportunities, and we'll keep sending them out. So thanks for the good feedback from everybody. And I don't see any more questions coming in, so I'll just say thanks again, and have a great day. Bye-bye.